Welcome to Essential Therapies Podcast. Dr. Cindy here with more road reflections on my commute. And today I would like to talk about some common myths surrounding myofascial release. So, I hear this all the time where people will say, isn't it going to hurt? That's probably one of the biggest things that I hear as far as a myth, because I will either be talking to someone about what it is that I do outside of the studio and find out that their impression was that it's something that hurts. So they would never even look into it anyway. Another thing that happens is I'll be evaluating a new patient and it comes up in our discussion then that they're just kind of expecting it to be something that is uncomfortable. And I'm sure that this got started with just the basic deep tissue massage or maybe even rolfing, where there's a lot of discomfort associated with this hard pressure that is used in this type of treatment. But really, it couldn't be further from the truth with myofascial release, because the John Barnes myofascial release approach is very gentle, and we use a pressure that is very light so as to reach the barrier or the restriction in the tissue and not force through it. So sometimes it's more pressure than others. It depends on what's going on in that particular area of the body and that particular person and so on. But very rarely do we ever get in and dig into an area creating pain. Now, that would be using a technique that John Barnes refers to as the old MFR, which is just that, doing some soft tissue mobilization or some deep tissue work to break up the cross links in that soft tissue. And that's not really myofascial release in the way that we use it for the John Barnes approach that's very gentle. So it's definitely not something that needs to hurt. So another myth that we often hear is that it's just massage. It's just basically massage. And really, it's nowhere near massage, because when you get a massage, someone is kneading the tissue. They're using their hands on the body in a rhythmic movement sort of way, which it feels very good and also has incredible benefits of moving the fluid around and changing the blood flow, moving toxins, that sort of thing. Lots of great benefits with traditional massage, but the technique is completely different. And they also typically use some sort of a lotion or oil on the skin so that the therapist's hand slides and glides over the tissue. So with myofascial release, there is no oil or any type of medium that is used on the skin. We want dry skin so that the hand is dry, the skin is dry, and the therapist's hand will not slide on the skin, so that we can actually connect into the body, connecting into the fascia through our connection on the skin with this gentle technique that we're using. So we're not moving our hands rhythmically. We're not using lotions. It is completely different from massage. We also hold the techniques for a very long time, waiting for the tissue to change, waiting for that collagenous barrier to soften and shift and change shape, which takes at least 5 minutes typically. So another myth that I often hear is that, MFR is just for athletes or people with injuries. So yes, although myofascial release is great for athletes or anyone with injuries or pain, it's thought of as, maybe it's really not for me because I don't have any of those things going on. And really, once you experience myofascial release, you can realize it is actually quite good for stress management, also postural correction, and just overall well-being. It really is a time for you to settle into your body, connect into your body, and feel areas that are tight and not moving well, areas where the fluidity of our body has become solidified and less like jello, more like concrete, and allowing the therapist to connect in and help your body to change that and become more fluid and mobile, so that not only movement is easier, but just the energy flow of the body, it just flows better, and it's very, very relaxing. So here's another myth, is that you can break up the fascia or break up knots. So I often have people ask me, just because they're used to the traditional massage approach, is they're expecting me to kind of dig into a knot, or do you feel this knotty area, and want me to focus right there. And yes, that is, and knots that we get like that are areas of restricted fascia. But I'm not just looking at that knot. So remember, fascia is continuous from head to toe. It goes through every cell of the body. And so it's not just one area that is affected. It is an area that has a trigger point there, which is really an area of restricted tissue, restricted fascia that has become hardened. And so, yes, we do look for areas that are hard, that are tender, and sometimes even warm. And all, trigger points typically meet all of those things: hot, hard, and tender. And we do treat them with this gentle, sustained pressure and the approach of meeting that barrier and waiting long enough for that to change. But it's not like the typical digging into a knot and waiting for that knot to dissolve. What ends up happening is the shift of the biotensegrity, or the collagenous structure, changing shape, softening, and allowing fluid flow to change there, and that solidification begins to again soften. So here's another myth about myofascial release, is that it's just like foam rolling, and foam rolling is basically myofascial release. And absolutely no, foam rolling is much different. And although it can and does affect the fascia, it is different in the ways that, again, like massage, that's moving rhythmically over the tissue. Foam rolling, especially when you're rolling, or even sometimes I've seen people ironing out their tissue, that's really not the most effective way to get to the fascia. Now, there are some softer rollers which can be used in self-treatment. And when we're trying to get the fascia to release or to change shape and soften, we want to use a gentle approach and find a position or a technique where we're letting the body be in a still position and using that tool to create pressure or elongation in the body so that the fascia will begin to change. And unfortunately, what I have also often seen is that people have really gone too far with the roller and created a guarding or a tightening in the body, and sometimes even bruising, which can make the myofascial restriction even worse. So, the roller can be a good tool to use, especially a softer roller, if we're using techniques that are gentle enough and long enough with that gentle sustained pressure. But it's certainly not a complete substitution for hands-on myofascial release. So another myth that we sometimes hear is that people think, oh, I can go get myofascial release technique or approach or a treatment, and one time or a couple, and it should be totally done, and I don't need it anymore. So once in a while, we have some amazing responses to treatment, and maybe someone seeks us out because they have a pain that has come on and they really don't know what to do. Nothing has really worked. So I will give a session of myofascial release a try. And although that is great, what I caution is the mindset that, oh, let's just try it one time and see if it's any good or not, right? Because oftentimes one session of myofascial release will not fix all of your problems. So once in a while, I have that amazing moment where one session really turns someone completely around, and it was our first session, and it's amazing. But most of the time, there's so many layers of what's going on in this person's body, and it's the last straw that is breaking the camel's back, right? So finally, they've they're seeking out something different. And many times, in fact, the last several new patients I've had in the last couple of weeks, they all had tried other things. And whether it was physical therapy or other treatments, they did not get relief. And so there's lots of things going on there, typically by the time we see them. And it's more than just one session that's going to do the trick. So I encourage people to give several sessions a try. And the closer you put those sessions together, the better, because it's less time for the body to go back to that subconscious holding pattern, where then it's harder we're kind of starting over again, So I just saw someone today who is some significant restrictions throughout the body, and I encouraged returning a couple of times next week so we can get things going in the right direction sooner, and also you're receiving relief more quickly, and in the end you're actually spending less money and having less sessions overall because you're getting on top of it, especially if your self-treatment is on point and you're being consistent and learning about your body to be able to extend that relief, your myofascial releasing on your own. So, okay, there's a few myths about myofascial release. If you have some more questions and want to hear more, feel free to shoot me a comment below and we will bring it up on another Road Reflection sometime soon. Meanwhile, remember, you are creating tomorrow's body today. So what you do today counts. Have a great day, and we'll see you next time.